prevention of dental and gum diseases in austere environments. Now, what is the relevance for you as a medic? Now, in austere environments, as a medic, you have enough work on your hands. You're generally overworked and stressed. So therefore, you do not want to add dental and gum issues into your already full burden. These dental problems are generally easily preventable issues. So by preventing them, you will definitely greatly help in reducing your stress levels. Because when you're faced with dental or gum diseases, that pushes you way outside your comfort zone, and your default option in those situations would be to medivac this patient at some stage. Now, this would cause financial cost to your organization, which, as I said, could easily have been prevented. Preventing dental and gum diseases in an oil and natural gas environment, on an expedition, or in austere environments would greatly increase the efficiency of your organization. Because a patient in pain is going to be less efficient, and when already there's burden of work, when you lose an employee due to medivac caused by a preventable issue like dental or gum disease related pain, it would greatly affect the efficiency of your organization and the productivity of your organization. So therefore, how do we do that? This starts with the dentist or the dental therapist, who for endurance athletes we put in the category of oral health coaching. Now, individuals who we deal with essentially on expedition, patients or clients are working on shifts or in austere environments like in the armed forces, they all belong to a high risk group, a group that is at a high risk of getting dental and gum diseases. And for this population group, we strongly advise that they go for a dental checkup not every 6 months, but every 4 months, so 3 times a year. And they must, or you must proactively encourage them to go for a dental checkup at least 2 to 3 months before deployment. Why? Because that would give the dentist sufficient time in diagnosing, treating, and managing complex dental problems and giving the patient a chance to recover after this treatment. If it is done at the last minute, the patient may not have the opportunity or the chance to recover from a complex dental treatment like extraction or root canal treatment. Also, we advise these patients, because they are in a high-risk group, to suggest or request the dentist to have tropical fluoride varnish to be applied on their teeth 3 times a year. We do that for all the children and for a high-risk adult group. And since our patients belong to the high-risk adult group, this may be a good opportunity to have a strong, concentrated tropical fluoride application on the teeth. This can be done up to 3 times a year and greatly prevents dental or gum diseases on teeth. Going for a dental checkup, the patient can request to get a dental charting. This dental charting, they can have it filed with you or uploaded on your computer. So you would therefore know that where in his mouth he's got silver fillings, whereas he got the white fillings, which look incredibly similar to normal tooth structure. Which of the teeth have got crowns on them As you can see, the crowns nowadays are so good that it is difficult to differentiate from normal teeth. But if you have a charting and you know that an artificial crown has been placed on a tooth, it is really worth your while to know which tooth does have those crowns. Also, it would give you an idea that which teeth have got really deep, potentially troublesome fillings, which of the teeth have got a root canal treatment and are therefore dead and don't have a nerve in them, and whether the patient has got impacted wisdom teeth that may or may not give them problem when they're deployed in an austere environment. So how do we protect or prevent getting dental problems on an expedition or in an austere environment? Firstly, we try to limit the factors that cause teeth and gum problems. Now we know that it is the frequency of sugar intake that causes dental and gum diseases. But let us realistically look at this scenario, and in the scenarios which we deal with, for example, high altitude climbing, endurance sports, it might be difficult in reality to control the frequency of intake of sugars, which are quite important to maintain the energy levels for our patients. So now, because we know we're dealing with an environment where we're going to expose the teeth with a high frequency of sugar intake, we now have to protect the teeth. Now, how do we protect the teeth? We can protect the teeth mechanically. We can protect the teeth chemically using medical means. And we can protect the teeth physically. So first, let us see how we can mechanically protect our teeth or the teeth of our clients. We can do that by encouraging our patients to floss at least once a day before brushing their teeth. The floss is a thread which goes between the teeth, get rid of the dirt and debris between the teeth, allowing the toothpaste to go between your teeth. After they floss their teeth, we then strongly advise our patients to brush their teeth twice a day for 2 minutes in the correct way. We also suggest that they must wait at least 30 minutes after taking any acidic food before they brush their teeth. Why? Is because the acids in the diet have softened these teeth. And then when we scrub them really hard, this will cause mechanical wear or increase the mechanical wear from the tooth surface. So if we wait for 30 minutes after eating an acidic meal, then it gives saliva enough time to buffer the effect of the acid on the teeth, preventing excess mechanical loss of tooth structure from vigorous brushing. When we brush our teeth, we strongly advise our patients to spit but not rinse, because toothpaste is a medicine, and this medicine needs time to act. So if you wash it away, it will not give the toothpaste enough time to work on the teeth. Statistically, through research, we have found that when the patients don't rinse their teeth, leave the toothpaste on the teeth, it increases the efficacy of the toothpaste by 25%. Electric or power brushes are better than manual ones. Why? They brush better. They have a timer to make sure that you do brush for a full 2 minutes. And most of them have a pressure sensor preventing you from putting excess force on your teeth when you brush your teeth. Aggressive or forceful toothbrushing, what it does is that it wears the gums away from the teeth. It pushes the gums away from the teeth. pushing the gums down, exposing the neck of the teeth. Now, the neck portion of the tooth is softer than the top portion of the tooth. So the brushes wear away the neck of the teeth, which is the softer aspect or softer part of the tooth, causing depressions to form in them, which increases the sensitivity. Also, we strongly suggest that it is not necessary using a mouthwash, and definitely not after brushing your teeth. That is because toothpaste is stickier than mouthwash. Toothpaste has a higher fluoride content than the mouthwash. So you are washing away a medicine which can stick longer and has a higher fluoride content and replacing it with something which is going to stay less on your tooth and has less fluoride content. If you do want to use a mouthwash, we recommend that you use it in the afternoon as a top-up rather than after brushing the teeth. Also, we strongly suggest that you do not use an alcohol-containing mouthwash because the alcohol in the mouthwash kills the good bugs as well as the bad bacteria in the mouth, as well as alcohol sucks out the moisture from the teeth, causing increased dryness in your mouth. So therefore, we strongly advise that you do not use an alcohol-containing mouthwash. Now let us look at the traditional blind spots or the stagnation areas we have found when we have been looking through our clients and our patients on expeditions. One critical area is the area on the cheek surface of our last upper molar teeth. Now, when you are in a high altitude environment, the lips tend to get dry and painful. So the patients are unable to open their mouth well, and it hurts when they try to brush all the way to the back. So we tell them that open your mouth halfway so that the cheeks are loose. This allows the muscles around the mouth to be more relaxed, allowing your toothbrush to go all the way back to the cheek aspect of your upper last molar teeth, where food tends to stagnate in this environment. Another area or a blind spot area is the lip surface of your lower anterior teeth. What happens is that because of the lower lip rests against the lip surface of your lower anterior teeth, patients tend to brush just above the level of the lip. This causes debris to collect along the gum line of your lower anterior teeth. This causes problems over a certain period of time. So what we suggest is to pull the lower lip down, exposing the gum line of your lower anterior teeth, allowing your brush to go all the way to the gum line of the lower anterior teeth. Another blind spot is the tongue surface of the lower anterior teeth, because this area is difficult to reach, as well as the pipes which bring saliva in the mouth opens directly behind your lower anterior teeth, and this area is an area which is rich in calcium. So therefore, very often food and debris starts collecting on the tongue surface of the lower anterior teeth. How do we get around that? We get around that by advising the patients to take the brush straight, not horizontally, but put the brush vertically straight down like that. By putting the brush vertically down like that and brushing up and down on the back surface or the tongue surface of the lower anterior teeth, you will manage to get all the way to the gum line there, preventing the collection of food and debris on the gum line, on the tongue surface, of the lower anterior teeth. Another area which is an area of increased collection of food and debris in an austere environment is between the teeth. What happens is that it's quite hard to brush between the teeth. We therefore advise the patients to floss at least once a day between the teeth. However, if they don't do that regularly, food and debris collects here. So infrequently, when they pass the floss in between the teeth to floss between the teeth, this causes them a lot of pain and the gums start bleeding. Due to this, they immediately stop flossing. What has happened is, because food and debris has collected between the teeth, this has irritated the gums. The irritated gums are inflamed, and therefore when the floss touches it, they start bleeding. How do we get around that? We strongly advise them that wherever it bleeds, to concentrate more in the brushing and flossing in that area rather than less. As they regularly floss in that area, they'll remove the food debris over that area, reduce the irritation on that area. This would create a nice healthy environment. The gums will heal, get firm and pink, and the bleeding will then stop. Another point of contention or issue which has crept up in our experience is that the patients complain that occasionally when they pass a floss between the teeth, this floss gets stuck on their fillings, and they are worried that they will rip the filling apart when they pull the floss out. If that happens, we suggest is to just pull the floss gently horizontally rather than pull it out vertically. So pull it out horizontally, that way it will prevent an upward traction on the filling where it has got caught. Or they can use interdental brushes. Interdental brushes are like little bottle brushes which you push between the teeth and get rid of food and debris which has collected between the teeth. They may be of the type whereby you have a wire and the brush bristles stuck to it like a little bottle brush, or they may be a stick of plastic with little serrations on the side. These are sturdier and more easier to carry. These could bend over a period of time. They are reusable and not disposable after a single use. Now, how do we protect the teeth chemically? We protect the teeth chemically or by medical means using a toothpaste. A toothpaste is a medicine in its own right. Now, for us who are in an environment which is either shift work, prolonged exposure to austere environments, we are in the high category of forming teeth and gum problems. So in those patients or in these circumstances, this is a very good toothpaste. It is known as Durafat 5000. It is a high fluoride toothpaste. It is available in the United Kingdom on prescription. However, if you did not have access to this toothpaste or you did not want to get a prescription toothpaste, then there are a good collection of off-the-shelf toothpastes. These can be divided into specialty toothpastes. For example, you may be a patient which has a high tendency of getting very sensitive teeth. You may be going in an area like Everest Base Camp, Everest, or mountaineering expeditions where you will be in a freezing cold environment, in which case you may think of starting on an anti-sensitivity toothpaste. Now, these anti-sensitivity toothpaste need some time before you can feel their maximum beneficial effect. So you have to be patient. It takes up to a month sometimes before you get the full benefit of using an anti-sensitivity toothpaste. And therefore, we recommend that you start this toothpaste at least a month or if not even 2 months before your deployment. You cannot mix and match different anti-sensitivity toothpastes because all of them work by a totally different action. So you cannot decide that this is on offer in a supermarket and I will get this one, and next time another one is on offer, so I'll shift to that one. You cannot mix and match. You have to stick with the same type of anti-sensitivity toothpastes. Also, you cannot mix this toothpaste with a normal toothpaste. You cannot say that you will brush with a normal toothpaste in the morning and an anti-sensitivity toothpaste in the evening, because all anti-sensitivity toothpaste form some sort of a barrier on the teeth. So the anti-sensitivity toothpaste will form a barrier on the teeth and a normal toothpaste will wipe that barrier off. So therefore, you have to stick and make that anti-sensitivity toothpaste your regular toothpaste. Sensodyne Repair and Protect is a good anti-sensitivity toothpaste because it has a medicine in it called Novamin, which forms a hard barrier on the teeth. However, if you belong to that patient category which is exposed to a lot of tooth wear, which can be mechanical in nature, and you have considerably worn out teeth, you might think of using a buffering toothpaste. A buffering toothpaste are very kind to the teeth. They're non-aggressive, they have less bulking agents, and they push fluoride onto the teeth. They do not treat the sensitivity like these toothpastes. All they do is numb the teeth up and thereby decrease the sensitivity. So these toothpastes treat the sensitivity, these numb the teeth but prevent wear of the teeth. However, if you cannot get hold of the specialty of the shelf toothpastes, then you can just invest in a good generic brand of toothpaste, a reputable generic brand of toothpaste. What you should avoid is aggressive toothpastes. So you should avoid smoker's toothpaste, charcoal toothpaste, or whitening toothpastes, because all of these causes progressive increase in sensitivity on the teeth, and in an austere environment they might cause issues at a later date. So hence we suggest that you avoid those variety of toothpastes. How do we protect the teeth physically? Due to the nature of sports or due to the alignment of your teeth, the patient may be predisposed to dental injuries during their deployment, in which case we suggest that they get a mouth guard. Now these mouth guards are of two types. One you can get off the shelf and some you can have custom made. The custom made mouth guards are better than generic off the shelf ones because they fit better, you can breathe better, they protect the teeth better, so therefore they're far better than off the shelf ones. In the process of an event, how do we protect the teeth? Professor Needleman has suggested the 2-bottle strategy. So especially when you're training for an event, 1 bottle contains your high carbohydrate acidic drink, the other bottle will contain normal water. So first you have a sip with the high carbohydrate one and then follow it up with a sip with normal water. When you're in an event and using gels, energy gels, we suggest that you just gulp it down and do not swish it around the mouth. Also, if possible, time the consumption of the gel to coincide with a water stop. Because if you drink the water immediately after the consumption of the gel, it washes the adhesive gel away from the tooth surface, as well as it is noted that it increases the efficacy of the gel. Now, how do we protect our teeth and our gums on an expedition? The mouth, the lips, the gums also need certain degree of protection. So let us look at lips. Now we know that there are no oil glands on the lips, so it is highly predisposed to drying. It can lose moisture 4 to 10 times more faster than any other parts of the human body. It is exposed to UV light, freezing cold, dry wind, exposed to trauma, so that needs our protection. Also, individuals are predisposed to get dry, sore mouth. That is incredibly common in high altitude or desert environments. Why? Is simply because of the air is dry, there is lack of water vapor, the low air pressure with the reduced oxygen can lead to dehydration, increased exertion is causing mouth breathing, and added to that, you have poor diet and stress. So how do we protect the rest of our mouth from all these insults? Buff insulated mask or balaclava can be used in the day while walking or night while sleeping. It will protect the lips, warming your inhaled air as you breathe through it. Making sure that your hydration levels are up to mark. Consuming warm water with the presence of steam will moisten your throat as you drink it. Using a good quality sunblock or lip balm. Sunblocks are better. They are zinc oxide based. They block the UV light better. Or you can use a lip balm with SPF 30 or higher. One must make sure it's obtained from a reputable source, do not contain any allergens, and are effective. Also, avoiding overexertion. Poor fitness levels and increased exertion will increase the mouth breathing, further drying the mouth and the throat. If your patient is an asthmatic, we advise them to regularly rinse their mouth after using a steroid inhaler. Making sure that there's access to throat lozenges, helping to ease the pain in the mouth and the throat. So therefore, it is a combination of preparation where you increase your fitness levels and walk with a pace which will keep your mouth breathing as low as possible. For prevention, using a buff, lip blocks to prevent your lips reaching the stage of being incredibly painful, dry and cracked. Keeping an eye on the hydration levels and treating the patient holistically. If you find that the lips are cracked, don't just treat the lips. One must look at the patient fully, check the patient's hydration levels, check the patient nutrition, and if nothing works well, you might think about the concept of giving the patient certain amount of rest and recovery, and of course, the adequate medication needed to make the patients comfortable and aid with their recovery. So it's a mixture of factors where you're dealing with the patient as a whole and not just dealing with the main symptoms. So what is a clinical application for you as a medic? Preventing dental, gum diseases and mouth problems on an expedition or in an austere environment will considerably help in managing your stress levels. You can be a part of the team, an active part of the team, a front runner to initiate and propagate a prevention strategy. Now, this prevention strategy is a team-based effort. It involves not only the medical team, but it starts with human resources and admin. Added to that, you must get consent, permission, and organize the whole preventive strategy with your medical team. Now, together, by establishing a good preventive regime, you can encourage and proactively initiate a good pre-departure dental checkup and make it coincide possibly with the medical checkup to prevent getting dental and gum diseases on an expedition or in an austere environment. Once the patient comes to your station or is comes to the location or deployment where you are posted, you can initiate procedures to remind the patient in the maintenance of their oral hygiene, in the maintenance of their gum health, and maintenance of their mouth to prevent getting dental and gum diseases. By maintaining a good, strong team preventive effort, we can prevent medivac of the patient, we can increase the efficiency, and all this makes so much economic sense because it increases the efficiency not only of that individual but also of the entire team, and thereby considerably decreasing the risk and the frequency of medivacs. So in our next session, we will discuss in your planning when you are faced with a dental or a gum problem in an austere environment. How would you prepare yourself? How would you choose a location? What will be the patient's position? How will we isolate the area which we want to treat? And finally, how we will examine and treat this patient. Thank you.